Aesthetic facial anatomy, Ali Pirayesh. Lip enhancement. It is important to realize with lip enhancement that we have to mitigate the vascular supply. The bifurcation of the superior and inferior labial arteries is at the S point. Here we have the superior labial artery becoming the philtral artery and the inferior labial artery. In this technique we use a 27 gauge 40 millimeter needle, but the procedure can perfectly be performed also with a cannula. We rest the needle or cannula at the vermilion junction and we insert. At this point we aspirate until we have a bubble. After comforting the patient, we advance the needle, failing short of the philtral column. We allow the plunger to show us the amount. We re-aspirate. And with retrograde injection, we inject very, very slowly. Slow injection of a low to mid G' filler allows the tissues to fly away and we make sure we do not have overzealous projection. We check regularly during the injection. Keeping in mind, in Caucasians, there is a 1/3 to 2/3 balance of the upper and the lower lip. Per side, in this patient, we have injected 0.2 milliliters. We withdraw the needle and leave the platelets to aggregate. Aesthetic facial anatomy, Ali Pirayesh, aesthetic enhancement of the lower lip. We have enhanced the upper lip, and what we will do the same for the lower lip, where we leave the first 0.3 millimeters alone from a line, a vertical line from the nasal base. At this point, after meticulous cleansing, we inject, after introduction of the needle, aspiration for 10 seconds until we see a bubble. Turn so we can see our plunger and we can see how much we're injecting. So we're injecting slowly, but deliberately. a low G' filler with a good extrusion force for fine modification, and a mid G' filler with a good extrusion force for volume is what we need for adequate lip enhancement. 0.2 has been injected on the hemi lower lip. We place our gauze, and at this